So glioblastoma, as you know, is the most aggressive brain cancer, very poor outcome, poor prognosis. Median overall survival is about 1.5 years, so quite unmet need there. Prior immunotherapy trial has failed to improve the outcomes in this patient population. Unique about the gamma delta T cells that they can identify and kill tumor cells without the antigen presenting cell process like MHC unrestricted. And the chemotherapy upregulates the natural killer ligand, which is a target for the gamma delta T cell. One of the challenges is the chemotherapy that we use, like Tumor, is actually lymphodepleting, so it kills gamma delta T cells. By using genetically modified cells, we can actually give the Tumor and the genetically modified gamma delta T cells concomitantly, allow them to function despite the chemotherapy environment.